The disparities in healthcare across the country and in the state of Nebraska are substantial.
Almost 30% of American Indians who live in Nebraska do not have access to health insurance. Um, and then they're followed by Latinos, who pretty much 1 in every 5 Latinos that live in Nebraska do not have access to health insurance, and about 19% of African Americans.
Under the state's new Medicaid program, those gaps are expected to get smaller.
About 90,000 Nebraskans will now be able to benefit from the expansion of Medicaid.
While Medicaid is expected to make that difference, a few organizations in Omaha have worked together to help the underserved population.
We know it's a big need in the community. We know that this is something that if we can get whole healthcare going and have so many services in one place, we know that's best for a lot of our patients who maybe don't have all their necessities met.
The Methodist Community Health Clinic looked to help the people who needed it most.
We kind of did an actual assessment of our community. Where are we missing? Where are we missing healthcare for our community? Where are they in the most need, but they don't have the access? And in that search, we discovered that Kountze had that same thought in their minds.
The clinic, along with Kountze Memorial Lutheran Church and Lutheran Family Services, moved into their new location, the Kountze Commons, in 2017, where they focus not only on treating their patients, but on getting to know their patients, educating them, and using each other as resources to give patients the help that they need.
A visit here is not a simple 5 to 10 minute visit. It's an evaluation assessment of their medical status, but it's also an assessment of what things play part in them staying healthy and how can we get them to the resources that they need. So then we may make a referral to a food bank. We may make a referral to a housing authority.
The Kountze Food Pantry is one of the programs they use to provide for their patients. They served around 760 people with food and wellness kits Monday alone. Although the pantry only runs Mondays and Fridays, that food is still available for patients at the clinic.
We've had patients that have had food insecurities and they don't have any food to go home to after their visit. I've collaborated with the pantry, the Kountze Pantry, and provided them with some food to take home.
Another program that they all collaborate on is the Healing Gift Free Clinic. The free clinic is open every Thursday from 4 to 6 p.m. inside the Methodist Community Health Clinic. All of the healthcare professionals volunteer to help those that are financially in need.
You can get things done like primary care. You can see, as I mentioned before, specialists like cardiologists, orthopedics, dermatologists, dietitians, behavioral health. All of those are possibilities.
If patients can't afford a service or medication, many times after a checkup at the Methodist Community Health Clinic, they'll be scheduled to return for the Healing Gift Free Clinic so that they can get the help that they need.
We utilize them, they utilize us. It's pretty much a back and forth collaboration. And they have been very, very supportive of our goals, and we are very supportive of theirs, mainly because they're pretty much the same.
The Kountze campus and what they've done to help those in need is a perfect example of when we come together for the common good, we can make a difference. Reporting in Omaha, Zach Williamson, 3 News Now.